A very warm welcome to everybody. We had a very good before prep panel call, and this afternoon we had a very good discussion about a very informative information with Beatrice on allergen management and the framework around it. And very excited to have this mix of industry, academia, and the restaurant group to add insights. And yeah, let's dive into it. I would start with Kate, just to continue on the conversation that Beatrice started, the kind of work that Food Allergy Canada is doing, right from the framework to the training and the tools creation. We talked more about the manufacturing side, but the restaurant service is what we want to have more focus on this afternoon.
Sure. So for anyone that's not familiar, Food Allergy Canada is the national non-for-profit and patient organization. So we represent Canadians living with food allergy. We're actually celebrating 25 years that we've been around this year. I know, right? So Beatrice, my colleague, for anyone that saw her speak earlier, she supports food manufacturing and regulatory affairs, and I support the food service industry. So I joined the organization in 2023 specifically to create more awareness and reach a mutual understanding to support the industry in serving consumers with food allergy, and of course at the same time better protect consumers and have confidence in the food service industry itself.
And what do you think are your major challenges currently around the framework in terms of training, in terms of the knowledge gap, and in terms of just the various sector people that work in your field?
Yeah, so I mean, I work very closely with food service, with public health, and for anyone that's familiar with that side of the food industry, I mean, the food service industry is very different where there is no regulation in place specifically when it comes to managing allergens in that environment. So there is some content in the food handler certification, which varies by province and really doesn't focus on the unique requirements on having a process in place and effective communication to help prevent allergic reactions for consumers. So when it comes to the gaps, I think we really need to kind of get back to basics in that industry and help build more informed, educated staff, because people that work in food service, and that's where I actually came from before joining the organization, they want to give a good experience to folks with food allergies, but they don't necessarily have the tools and the education and knowledge in order to do so. And equivalently, people with food allergy want to dine out, they want to have a good experience, but a lot of the time there's fear and they don't have confidence, and there isn't a consistent approach to managing that restaurant to restaurant, food service to food service. So we've been working collaboratively with the industry to support with filling that gap, and I'll talk a little bit more about the program that we have and what we're doing in order to do that, and also engaging public health with a unique focus on education and health promotion in absence of a specific regulation.
That's amazing. And I think, Rob, you have the insights and the experience in the restaurant groups to add right in there. There's the tools that Food Allergy is working on, and in terms of ideation to availability to the people that you work around in your facility. You had the restaurant group, hotel chains, and would like to know what are your challenges to having those resources available for use?
Yeah, I think our big mandate for, especially with food allergens, which is although it's been around for 20 years, is for restaurants still a pretty new thing outside of the normal vegan, gluten-free designation on menus. So I think this all starts with the confidence of the servers and the service providers at the point of service, and being armed with that right knowledge to be able to answer diner questions. And especially when it becomes, the diner questions with allergens become almost technical, and we have to give the right answer every time. We can't give a so-so answer, or we can't sort of guess at it. And I think for us as an industry, as a provider, and for a training mechanism, I think that's our biggest challenge, is to, A, make sure we have the right information, be able to train it in a timely fashion, and to be able to present and provide our service providers with the right level of confidence that they are able to answer diner questions directly, so we can give that great service experience.
That's interesting. And I remember that we were just talking about it earlier, and you used the word that it's happening in the now. So while all of this background work that is happening around this awareness, what are you currently using as resources and tools in the now? Like, give us a window into how does a day look like in your line of work today before we build all these resources? Yes, that's you.
Sorry. You know, a lot of our hotels are actually working with third-party agencies which specialize in allergen education. You know, there's an enormous amount of information out there. We actually use some of the Canadian food allergen resources, but we actually work with some specific food allergen educators who actually go and do one-on-one training with groups of our associates just to make sure that they understand the basics, not just in terms of how allergies can negatively affect people if they're not identified, but how to understand the vernacular in terms of the questions that the guests are asking, which, you know, for someone who is not trained and does not have the understanding, it can be quite a daunting and complicated subject matter on top of all the other menu-specific duties and knowledge that they have to have.
Interesting, and that brings me to you, Frank. Like, being from the academia background, how do you think academia can bridge the gap between the industry and academia in general and the challenges that we see? What role does academia play into it?
As an educator, and I am a director of food and beverage, there's a gap in the industry of what we're learning compared to what's going on in the industry. We look at stuff we're teaching now. This industry evolves quickly. We've been sitting here for the past 2 days, and we see how the industry has evolved and evolved and evolved. But does that mean we're taking the information and changing course curriculum, changing course material? I can safely say some of the course material probably hasn't been changed in 2 years. We need to speed up. We need to partner up more with the industry and create that less of a gap between the industry and our educational system, so it's a smooth transition for the students from educational classroom into the workforce.
I see, and we have all the experts in the room right now. So let's say somebody coming from academia, what would you pitch to the industry leaders? What tools or information can the industry bring to academia to kind of like meet somewhere in the middle?
Honestly, co-op. I was talking to somebody, I don't know if they're still here, about co-op and offering internships. The students are our future. We need to support them. We need to educate them. I remember when I did co-op, many years ago, I'm not going to tell you my age, I did co-op, and I didn't get paid. It was basically your learning is what you're gaining from it. Well, now rules have changed, and we do pay our students. Make that investment in the student. Make that investment into the future, because without our future, we're just going to keep lagging behind.
And that's where we come to manufacturing, like co-op along with like internships and using summers to have young people coming in and having ideas to have fresh pair of eyes in the manufacturing world. So that brings me to you, Gwen, where what do you think are the most critical points in managing allergen risks in a manufacturing environment, and how do you conquer that?
Yeah, absolutely. And I think allergens are just a reality of most of our lives when we work in manufacturing. They can be really, really scary. You know, especially when you have an allergy. So, you know, wheat, I'm a little celiac. It doesn't go over well with me. And we do produce gluten-free products at Embassy Ingredients, also wheat products. So, you know, we're dealing with a lot of risk. So the thing with controlling allergens is it's not one big point. You control it, hey, you're good, we're good to go. It's small controlled points throughout the entire process that everything has to work perfectly. You know, one link in all of those controls break, and the consumer is going to really pay the price. Then on top of that, the complexity of people. Everyone's different. I love the idea of co-op students. I did co-op, also won't age myself there. But you know what? It's what made me passionate about the food industry. Before co-op, I didn't even know this all existed. And it was something, I got a random job in the food industry, and I loved it. And that was it. But, when you're really diving into processes, know your risk, know what allergens you are dealing with, know the form of the allergen you're dealing with, and go back to your HACCP plan. You're identifying that allergen, it's a chemical hazard, where is it, and, really focus on each of those points.
Interesting. And when we talk about resources, just the parity of resources and the lack of it around industry, academia, or the restaurant group of services, I know, Kate, you mentioned resources and tools that are available for all sectors, like not just restaurant, but knowledge is knowledge in all forms. So maybe if you could give an audience a window into where these tools could be accessed.
Yeah, so part of the work that we've done at Food Allergy Canada, kind of when it comes to food service and restaurants and hospitality, is we have an industry council, and that's all different food service formats. I know some of which are in the audience somewhere, but we looked at quick service, we looked at dine-in settings, we looked at hotels, we looked at food service retail. We have robots serving tables these days, third-party delivery. Like, there's so much going on in the industry, and it's exciting and it's dynamic, but the overarching theme is that we need to improve the knowledge of food service workers across the industry, something that is consistent and available for all different food service formats, that kind of meets what the challenges are, which we've heard is staff training, high turnover rates, balancing operational priorities, cost factors, supplier accuracy and ingredient substitutions. So how can we look at all of those challenges and take them and turn them into solutions? So in 2024, we did a consumer research report, which was really, really interesting. I mean, just show of hands, how many people have food allergy in the room? Okay, so I see a few. Raise of hands for anyone that knows someone with food allergy. Oh, a whole lot more hands go up, right? And what we see is that there's such a huge impact when people choose where to eat and who they're eating with. And that comes down to, it could be my birthday, but Frank has a food allergy and he wants to go somewhere I feel safe, right? And does that restaurant have a safe menu option? Do they have an allergen management process in place? What does the information on their website look like? So many different factors that guide those decisions. And again, when we look at a national scale, public health websites, existing food safety resources that are available, there's a very large gap in accessible information on managing food allergy. And there's the unique kind of focus on communication, which Rob spoke to as well, but you look at we can't play broken telephone with food allergy. You have a conversation with a server that often goes to the back of the house and then back to the front of the house, and there's all these different points where a loss of control is like break of a chain. So anyway, I'm rambling, but we've created a program called Think Food Allergy, which is exactly what we want people to do, focus on basic awareness and education. And it consists of fast, easy, and free tools for the food service industry. So we've got a bunch of micro-training videos, which are super great for a food service setting. So 3-minute kind of TikTok style, posters, fillable recipe templates, where when someone asks you a question, you can use these tools and say, here's the information I have. They can be updated and reviewed regularly. So, I think what we're focusing on is building the foundation for food allergy and taking it seriously, the unique focus that food service specifically has on communication at ordering, preparation, and delivery, flagging the food allergy order at every step of that process. And then we're also working on building national guidance. So we're expecting that to be ready next year, which would be great, and it'll have additional tools and resources to complement the information there. So of course, this is open access, it's free, it's thinkfoodallergy.ca. So we're really focusing on how we can support the industry so that they can better deliver on consumer expectations.
Interesting. And when we talk about risk management, like a risk management approach to managing allergy, I mean, in terms of different sectors, like Frank, that I would lead on that question to you. When you think risk management in terms of a course framework for students, because it starts there and then anything that builds there is relaying to the industry and other services. So what are your key areas of focus in terms of giving that education to your students?
I would say assumptions and not to make them. Last week we had a function for 300 people. Out of that 300, 40 had an allergy, or 40 had a food intolerant. We have to take that stuff extremely seriously, no matter what. Because one mistake, one assumption as, oh, it's okay, they're not just that allergic, they just don't like to eat it, or that's okay, they just don't like it, that is life or death. So I'm going to use the word assumption and never, ever to make that assumption, and always, always assume the worst case scenario, and hence why the people matter. And people are what we need in order for everyone to be safe.
I think that brings us to the restaurant group of services, and both industry and the restaurant group. When we talk about risk mitigation and critical areas of focus, what does it mean for you, Rob? And then we'll follow up with what does it mean on a manufacturing level to you, Gwen?
For me.
Yes, Rob followed by
So
Gwen.
I'm really lucky. This is actually one of our hotels. I work for the family who owns this hotel. And we literally, with events like this, we put tens of thousands of people through this building every single year, whether it's for a social event or a corporate event or an exhibition discussion event like we're here today. I would second that. I mean, first of all, assumption is not a word we use in our business with any aspect of event planning. What has become a real challenge with food allergens is, we still deal with the same, even though it's large here, the same kind of kitchen setups, the same kind of food preparation, production setups that we've used here for the last at least 25, 30 years. And it's one thing to be able to educate people at the point of sales and service in terms of being able to answer those questions. The other thing we have to do is make sure that our back-of-house departments, in terms of how this food is produced, to reduce the amount of any kind of cross-contamination in the preparation and production, that has to be very carefully managed as well. And it's not just quite as simple as switching on a light. I mean, some of this stuff takes a lot of capital investment to make sure we're able to do it, and as well the continued training of both front and back of house people. So it's an ongoing process, but I think as we were saying a couple of weeks ago when we were doing our practice call, the piece of the subject matter of food allergens has expanded way beyond just a casual conversation or someone may know in their lives. This is now an everyday occurrence. There's a lot of people that this very deeply affects, and assumption is just not an option.
Yeah, definitely.
It's a great takeaway, assumptions.
We don't like that word assumption. And I think, we do make quite a few assumptions in the industry in a lot of different ways. So definitely a lot of challenges with allergens. So complexity of the process. We're dealing with so many different factors that can go wrong, and there's zero tolerance. Now, kind of going back to assumptions as well, let's talk about the science of allergens a little bit and what we need to know about them. So I just made the most beautiful gluten-free mix you can imagine, gluten-free cupcake. It's awesome. Is it gluten-free? What does that mean? So I hear the words gluten-free as a consumer, and I think, sweet, there's no gluten, I can eat it. But there's detection limits. There's only a certain amount of gluten we can maybe see. What do we not see? We're making assumptions about that kind of thing. So I know, because I know a little bit about food law and regulation, that means there's less than 20 parts per million of gluten in there. And for me, that might be okay, but for someone else who might be celiac, that's not okay, because different people have different sensitivities. So I think that is something really important for us to be very mindful about.
And since we are talking about threshold and allergen threshold doses, that brings me to you, Frank. We've talked about threshold doses and the level of sensitivity that exists regionally different. It's different for people in different areas. And when we do ideate a product or label a product, it doesn't take that into consideration because the supply chains are complex and global. So what is your opinion on the work that the industry is doing on that level while reviewing ingredients and labels?
They touched on it earlier about labeling and some of the incorrectness that things are being labeled. I heard a great conversation yesterday about different aspects on where product is from being shipped and labeled and classified. We need more regulatory rules and staples to make sure that, to tell people that that's not okay. It's not okay to be 5% off, 1% off. We can't be off. Because anytime that we're off and someone takes a peek and you see that Health Canada check mark on it and then ingests it, it's a person making a mistake, and that person making a mistake can cause a life. That's the key. It all comes back to the people and how we're educating the people and how we're making sure people feel safe to say when something is wrong and not worry that they're going to lose their job.
And since we're talking about labeling and food allergy and labeling, this afternoon we talked about thresholds around precautionary allergen labeling and how the rules around it are so different. Let's say we are in Canada. It is so different from the voluntary and involuntary labeling in the US, where precautionary labeling is not mandatory. And then the risks around both of these regions are nearly the same, because as regions we are not so different and far away from each other. So how do you think that impacts just the overall public health? This is for you, Kate and Frank, both. You can take it one by
It's all
one.
you.
Go ahead. Well, I think when we're talking about food service specifically, so in terms of prepackaged foods, colleague in the back has worked collaboratively with the industry on some allergen management guidelines for food manufacturers, which is an excellent resource. And I'm sure lots of you have heard about it before, but when it comes to restaurants specifically, there is a huge inconsistency on what menu labeling specifically looks like. So we have the Healthy Menu Choices Act, which requires calorie counts. Other than that, there's nothing specific people need to put on their menus, and that could be partial information. This could be, pad thai with peanuts or pad thai with a creamy sauce and garnished with carrots. There's no real law or instruction on what that looks like, and we've actually done a scan, and about 9 to 11% of restaurants actually include full ingredient information available online, which includes subcomponents in the recipe. So from a consumer perspective, they already don't have the information that they need from an online perspective, and that often guides their decisions. So regardless, I think when that ingredient information is accessible, that makes a lot more confidence in consumers, and of course ensuring that it's accurate and that there's a process in place to provide that. So when we look at kind of, what we see that total process looks like, not to simplify it, but starting off by, having a standard in place to ask about allergies. So I always like to kind of give the example, you don't have to go and put your hand up when you go to a restaurant and say, I'd like the salmon or the chicken sandwich, and please don't give me salmonella in my chicken. Or you shouldn't have to say that, hopefully, right? But it is super important when someone says, I have a food allergy to milk. And that is critical information because it's going to guide the process that the restaurant takes. They might use a separate preparation area. They might have specific purple equipment in the back, and they use that. They're going to wash their hands. They're going to do a whole bunch of things when they know that information. So starting off by asking about allergies is the first step to make sure that restaurants actually have the information that they need in order to accommodate that guest safely. And then after that, there comes several other steps of verifying ingredients, communicating internally, preparing the food safely, to Rob's point, and having standards in place and control points to prevent cross-contact, and then delivering the meal the right way, right? So that could be at the pass, depending, again, like takeout, you're looking at, can I put a sticker on this item, or can I give a square plate for people with food allergies so that I make sure the right person gets the right meal? But there's so many little things to talk about, and honestly, there's not a lot of resources in Canada that offer that information and guidance to the industry. So as the patient organization, working collaboratively with them and with public health to share this information is what we're working towards, so that we have that consistent approach, and also looking at food allergy as a shared responsibility where we have a mutual understanding between the industry and consumers. Frank, do you want to add to that?
Not really. That was really good.
Yeah, that's a good stuff.
I think, sorry, to touch on Rob. Rob hit it bank on the nose. We need systems in place, but everyone needs to follow. And if you don't follow it, there needs to be major repercussions. And the problem is there's not. We can't be reactive when someone gets sick, or knock on wood, someone gets fatally sick, for us to react. We need to be proactive with this. And I can see it, and all of you also can. We're not.
So we've talked about lack of resources, lack of tools, and a lack of all other things, and that brings us to budgets. Budgets around the subject in industry, in academia, and in restaurant groups. Maybe we should talk about that a bit. In your each sector, how do you deal with the budgets around it? And as key decision makers, how do you advocate for budgets around it? We'll start with you, Gwen.
Sure. So I am very fortunate that I work for a company where food safety starts from the top. I've been with Embassy Ingredients almost 10 years, and I never want to leave because of that. And I think that's where it's beautiful. So I get to control my quality budget. I get a budget every year, and I've never once been questioned about budgets for allergens, which is amazing. Now, we do spend a lot of money on allergens. It is something that we do, but it's important, and it comes down to risk. So, for example, let's talk about testing. There are times when maybe the risk is low, very minimum, little risk. Let's talk about gluten-free raw materials, for example. So we are manufacturing those certified gluten-free products. So we have a lot of raw materials that we use to make them. If I'm getting a raw material from a gluten-free certified facility that doesn't test any other allergens that's coming into my plant, I'm not too worried about that. But I kid you not, it was 9 years ago when we were putting in our gluten-free program and I started looking at the raw materials. Hey, why does that sorghum flour say may contain wheat? And why are we going to be using this in gluten-free product? Every flour we tried to find at the time said may contain wheat. A little different now, we have more diverse suppliers, but in a situation like that, if we're not testing that incoming raw material to make sure it is gluten-free, we're causing a problem and we're bringing a hazard into our buildings. So very important to look at the risk and to plan for it and to get the support, advocate, sell it. A lot of the time, you know, if you're not always getting that senior leadership support, try to put your sales hat on. Be your director of sales and sell it to them why it's safe. Talk about recalls, provide numbers, provide data, how much a recall costs. A lot of the time, senior leaders, numbers will resonate very loudly. So,
It's interesting. We'll move on to you, Rob.
I would love to tell you there's a huge budget in the hospitality industry to deal with food safety and allergens, but in reality, that's just not the case. We do all kinds of food safety activities, including brand standards audits and health and safety audits, but in terms of allergen investment, it is very, very slim because it is a line expense on a P&L statement. It is a cost, and we already work in an industry where margins are absolutely thin, especially in the food sector. But you know that I'll say this as an operator, it's not something we want to happen. I think economy is going to dictate how fast a lot of this actually rolls out. You know, it's going to be the other thing I said when we were doing our practice that you know when you look at every major brand out there, including Hilton, Marriott, IHG, there are no brand standards regarding allergen education. None of the major brands have any standards regarding this, and they're global entities, right? So, you know, we are still, you know, with the work you do, which is great, but we are still, you know, just going over the start line in terms of getting this going. You know, I'm very lucky to work for an independent ownership who, you know, are very invested into guest experience. And in our business, there's only one question which we really care about from guests, diners, or people attending meetings is a question called intent to return. And with the amount of people in their personal lives where food allergen is a real factor in how they live and how they and they're, you know, they're key to their own personal happiness. You know, that is a question which, you know, for me, I will be pressing a lot harder in terms of saying, you know, if we want them to answer the intent to return question in a positive way, then we need to make the investment to be able to do this.
Interesting. Yeah.
Cute.
Go ahead.
Okay. I have 1 seconds left to answer this question. But I think I'm just going to kind of piggyback off what Rob said. So, I mean, in terms of budget, I mean, we're a charity. So in terms of budget, we do everything to support our community and support different sectors. But when I'm looking at kind of budget and how we can approach that while we're supporting the industry, again, all of our tools are open access and free. There's nothing required. You can go online and download or watch our videos right now. It's very, very easy, and we've really tried to target some of those challenges that the industry has and make that a key solution. But I'm also going to mention that like food allergy awareness is a huge win for restaurants. I'm going to recite a few quick stats. 80% of people with food allergy make decisions based on allergen management when they choose a location to eat. 44% of the general population chooses a location based on allergen management when they eat out with others. 86% of people with food allergy are extremely loyal and return to the places that do it right and that they feel safe. They find a restaurant where they feel comfortable. They're going to go back again and again, and they're going to go with their friends and family, and they often lead group dining choices, as I mentioned, but 37% of them feel that they lack safe food options. So there's a very huge opportunity for the restaurant industry to serve this underserved consumer segment by just doing something that should be happening already, which is allergen awareness. So I think it's a huge opportunity for the industry as a whole to better support this community and also get one of the most loyal customers that you'll ever have returning again.
Oh, me?
Frank?
Something to add, Frank?
I was in awe and wow with the figures that you're using. I think we can sit here and do a separate seminar just on this topic. It is essential, and I'm going to use the word all of you, the people. You are the people that save lives. You are the doctors. You are the firemen. You are the paramedics of food and beverage. It is up to you and us to educate people, to keep people accountable for making people safe.
That was very insightful, all four of you. That was amazing. With that, we open the floor to questions. I know Frank can't wait to get the podium back from me, but we have 2 minutes. We have 2 minutes to continue, and we open the floor to questions.
We'll have one question here, and then we'll continue on. If the mic works, yes, it does. There you go.
Thank you. This is for Kate, and it's kind of a contribution more than a question. I met with Kate last year with her team at one of the shows, I believe maybe RC show, but they came forward and they shared their manuals and the templates and the information because, sorry, my name is Andrea, I'm from Yummy Market. I wear a couple of hats. I'm in catering ops, but also I work with all of our prepared food. We do retail, food service, and it's a $100 million annual business. So lots of production areas. Now fast forward to the actual relevance. So thanks to the actual booklet that you shared with me and the templates, I was able to expand on that. And currently, I've created a central allergen management program in-house for over 1,200 SKUs that we produce, going back to the minute ingredient and full traceability to the supplier. So now the next step, what we are doing is that we have changed our scales, where now we will be able to print these allergens on each food item that we are selling. So the importance to me wasn't just the food allergies, but also my son has a very strict FODMAP diet. He lives with colitis, and some of the allergen ingredients are also in the FODMAP restrictions that could basically change his life forever. So I want to thank Kate, and I want to actually attest to the efficiency of the material and how helpful it is, and how much we can do. As you said, we have to be the ones who are making the difference. And how did I get my management to go along? The first question was, if someone calls from the hospital urgently saying they have a patient who had our food, are we informed to tell them what allergen was in that food? And there was silence. And I said, if we're making a difference between life and death, do you care? Of course. I said, what if there is a regulation where you get fined or maybe go to jail because of negligence? Week after that, we were implementing it. So,
Well
thank you,
said.
Kate.
Wow.
Thank you very much, and thank you our speakers. They did a wonderful job, literally. A wealth of information